Today, there are a combined 27 new local cases of community transmission around the country. On the second day of its snap 3-day lockdown, Queensland reported 2 new cases, bringing the state's total active cases to 43.
We have had record tests in the past 24 hours. We are very encouraged at the moment that we've only really got those 2 cases.
In New South Wales, there are 24 locally acquired cases, with concerns half of them were infectious while still in the community.
In too many examples, we're seeing workers who are leaving the house with symptoms and then inadvertently, as they're going about shopping or other activity, they're passing it on to others.
The Northern Territory has picked up just 1 new local case linked to the Tanami gold mine, but freshly locked down Alice Springs is still awaiting test results.
At this stage, our contact tracers have identified 69 close contacts. They are all in isolation and the testing has begun.
In Victoria, Tasmania, the ACT and South Australia, there were no new cases. And on day 3 of WA's 4-day lockdown, the state also reported no new local infections.
This is amazingly encouraging news, but the next 24 hours are crucial. Even if you think it's nothing and not worth it, go get tested.
Well, to give us his expert take on today's numbers, we're catching up with infectious diseases physician Dr Paul Griffin. Doctor, on Sydney, the New South Wales Premier sounded concerned about the number of people still out and about despite the lockdown. Is she right to be worried?
Look, it's obviously a difficult decision to go into lockdown. It's very difficult for those residents to be in a lockdown. But like all mitigation strategies, the lockdown is only going to be as successful as the adherence to those recommendations. So we really need people to do the right thing and also to have really high rates of testing so there's no one around in the community with symptoms. So I think it's right to be concerned and certainly encourage everyone to, get on board and do what's required.
Paul, we learned today... Sorry, Lisa. Go ahead.
I was just going to say quickly, how feasible do you think a lockdown lift is next Friday, given the way the numbers have been tracking over the last few days?
Look, I think we can remain optimistic about that. Obviously, the decision we made on the available evidence at the time and the case numbers, we have to remember that the cases diagnosed today weren't infected today. They were probably infected at around the time the lockdown kicked in. So hopefully what we'll see is the effect of those mitigation strategies and the lockdown kick in over the next few days and the case numbers start to decline. So at this stage, I'd be optimistic. But again, it's dependent on everybody doing the right thing and seeing those case numbers come down accordingly.
Paul, we find out today that a student nurse who's tested positive in Sydney, a close contact of hers works in aged care in Baulkham Hills. We've had to close that aged care facility and deep clean it. Are you concerned that these things are still happening?
Look, we do need to take these sort of things very seriously. We know the people in the aged care sector are extremely vulnerable to very significant consequences from this infection, and that's why they've been prioritised in terms of the vaccine rollout. So if we see what we should see, that the majority of the residents and staff there are vaccinated, then the impact of a potential introduction of a case will be minimised. But again, it's really dependent on the vaccine rollout and making sure that it's been effective there, and obviously the mitigation strategies that have been employed to combat this and stop the spread there.
The war of words over AstraZeneca continued today with the Queensland Chief Health Officer defending her comment yesterday that people under 60 should not get AstraZeneca and wait for Pfizer.
I am giving my advice. I'm a doctor. I've been involved in Australia's vaccination program now for 16 years. I am on the record as supporting vaccination, but I want the right vaccine to go to the right person.
You're also a doctor. Do you agree with her advice?
Look, I think this is a very challenging situation we've found ourselves in. It's clear the advice around AstraZeneca has evolved as the situation has evolved accordingly. And, ATAGI, our regulator, have done a fantastic job here of closely monitoring the situation both here and abroad and changing the advice to make sure we use that vaccine in the best possible way. So I think, that advice has been hard to communicate enough and, hard for the general population to understand. But if we add in differences of opinion between different states, and it makes it really hard for people to understand what the best advice is. So, I'd like to think we can have a bit more of a unified approach to how we communicate who these vaccines are recommended for and exactly what the risks and benefits are. And, I think it still stands that this is a vaccine, the AstraZeneca that is prioritised for people over 60. If people less than 60 would like to receive that vaccine or consider receiving it, they can have an open and honest discussion with their general practitioner where if they can understand the risks and accept those and still want to go ahead, then that should be an option. So I think, in short, we need to get our messaging on track so we're all on the same page.
You make that sound very simple, Paul. Thanks for your time.
It's a pleasure.
We saw the New South Wales Premier there, guys, saying that she's worried that people who are testing positive and have symptoms, they're still going out to work. And, you know, you've got a situation where a whole bunch of retail is open and, you know, shops that shouldn't be. And yesterday we had the Chief Health Officer in New South Wales say, oh, it's hard to define what's essential retail. Really? Is that the feeling in Sydney? Is that what's happening there?
What's your sense, Lisa? I mean, in my area, there's been, you know, a lot of people out and about, but of course you're allowed to exercise. But people playing basketball closely on top of each other sort of doesn't feel like it's in the spirit of it. What about in shopping areas?
Well, I would say whenever I go to the supermarket, it's about 50% are wearing masks. So the shops themselves last time were really monitoring masks. I don't get the sense that they're doing that if I'm seeing that many people without masks going shopping. And at the local cafe today, I reckon only about a third of people who were dropping in to get coffees had a mask on.
Yeah, right.
They almost all had active wear on, so they could probably argue I'm out exercising, but it didn't look very strenuous.
Lisa, come on. I mean, that's ridiculous.
That's what I'm saying. That would probably be the excuse that they would have, and I'm not about to point at people and say, put your mask on. But nobody else is, and certainly not the Premier doesn't seem to be getting that message across, mostly because we still feel like this is the lockdown you have when you're not really having a lockdown.
And it's a Sydney thing, isn't it? I mean, I get the impression that in Melbourne it's taken a lot more seriously and you've been through so much more, whereas there's a laxness in
So
Sydney.
Pete, in the supermarket, when Melbourne was in lockdown, just about everyone had a mask, right? Everybody.
Everyone. When you hear Paul saying he's optimistic about coming out after the 2 weeks, but it depends on people doing the right thing, and that's concerning to hear.
With so much content online, it's sometimes hard to keep up with it all. And let's face it, who has the time? The Project YouTube has you covered with the stories that matter. Hit subscribe for a daily list of the news that you need to know.